to WGSN-DB Going Solo Media. This is the Senior Citizens Forum, and I'm your host, Janice Wood, and our sponsor today is Benefits for You Too Insurance Services, where we do health insurance, and for both people that are 65 and below, and for seniors that are 65 and above, and for people with certain disabilities. But today, of course, we're not talking about Medicare. We're here with Heather.Reid from actually a year-old medical group called Welcome Health. Happy birthday!
Thank you.
How exciting it is!
It's very exciting.
Very exciting.
Officially seeing patients for a year. It's
Right.
gone by quickly.
And the growth has probably been amazing.
Yes, very much so. And it's nice to see our doctors out seeing our patients pretty much every day now because of the amount of patients that we're seeing. It's awesome.
That is really cool. So what we're talking about, Welcome Health, goes out and visits people like they used to do in the early 1980s and before that. Okay, so they are not a concierge program. They are a program for seniors, a medical group for seniors that are 65 and above. So even if you already have a Medicare Advantage plan or a supplemental plan and you're below the age of 65, at this point, they're not seeing those particular people. But they are seeing patients that are 65 and above.
Correct. All of our doctors are fully focused on geriatric care. There's a difference when we're over 65, our body changes, and we address primarily making sure that people can access their home accessibly, walking with no fall risk, and going through their medicine cabinet to make sure nothing is counteracting. So we're bringing back that old school mentality of a doctor coming to your home, especially for those that it's getting too emotionally or physically taxing to go out to an appointment.
Okay, but real quick before we go on with that, I want to talk about Heather and what she does. And you're a project developer?
Territory developer.
A territory developer. So she's out right now in the Orange County area of California.
Correct.
Okay. And she's helping to work in the LA County area also, because they're really big, they're growing fast and trying to find someone else to work with them. But Heather has worked in the senior citizens market, health insurance market in the past, and she's worked as a social worker.
I'm very fortunate as the territory developer for Welcome Health. I'm able to use all of my experience from over the years. Social worker at a skilled nursing facility, helping discharge patients from the hospital to skilled nursing, ordering home health when it was needed, discharging from the hospital. I've actually worked in hospice as well and a Medicare Advantage, so I have a little bit of everything, and now I'm with an amazing mobile medical group bringing doctors to the home, so working on the medical group side. So a little bit of exposure of everything, but I'm able to help be a resource when I'm out in the community.
Right, and so she's really a wealth of knowledge to have. She and I are starting to develop a good working relationship together because we've been going out in the community together in the pouring rain.
And hopefully it's more sunshine.
Right. More sunshine, okay. But we want to talk about Welcome Health, and I want to go back to what you mentioned just a couple of minutes ago. You talked about that medicine in the cabinet.
So a lot of people don't realize as we age, there's counteractions with our medication. So we address polypharmacy, which is usually the term meaning 5 or more medications. But just as what is your over-the-counter medications that are in your cabinet? Are they counteracting with the prescriptions by your doctor? So our doctors really go through and address all of that and make sure that you as a patient understand every single medication you're taking for and what are the potential side effects.
Right, and I think also from my experience in working with seniors, and I always look up all of their medications when I go to them, and sometimes I have to go, wow. I mean, there's so many of them.
I just sat down with a lovely gentleman, and he had about 9 medications, and it was so hard for him just to explain to me when they were being taken per day. So if he's having a hard time just explaining to me before he sees our doctor, we wanted to address that right away so that he understands what's the best time and see what could be discontinued so his life is better, because he's not just looking at those medications every day.
So if you went into my cabinet right now, okay, I just went through changing doctors and medical groups, and all of a sudden my doctors are going, you're taking too much medicine. Now, if you went through my medicine cabinet, you're going to find stuff I don't need to take.
Exactly.
And,
or expired medication. A good amount of our time, we kind of forget what's in there. And sometimes when we're having a cold come down, we immediately just grab and we forget to look at the expiration date. And it can be challenging to read those labels at times. They put it on the white side of the cardboard and it's hard to read. So our doctors will just have to make sure that you know that if it is expired, to how to dispose of it, and making sure that maybe your high blood pressure medication can counteract with some cold medicines. They'll help advise you for that.
now, I've been with people where they take out their bag of medicine and they put it out on the table, and then they go, oh, I'm not taking this one anymore. I'm not taking that one anymore. Or I've even had someone say, I don't know what I'm supposed to be taking anymore. And that one is very scary.
And I have personal experience with that, and that's why we want to make sure you're only having the medications you are taking. Reason being, if there is an emergency in your home, and one thing is to make sure everything's written down and put in your wallet, so if there was an emergency and you're outside the home, emergency personnel at the ER would know what medications you're on, especially if you have an allergy. Please write that down and put it in your wallet. But if, our family, we get in shock when someone needs to go to the ER, or if there's emergency personnel in the home, we forget the medications that our loved one's on, and we just grab anything that's in the cabinet. So it's best to make sure that you only have what you're taking in your home, and that way you feel comfortable when you're talking to your physician that you are confident in what you're taking daily.
Okay. Well, one of the things that I've been going around and telling people to do, which I've done, I've gone into my smartphone,
Or
and there's an app in the smartphone that you can put down your medical conditions and what medicines you're taking.
So that is a new thing now, and it's also part of people that have their Fitbit, which is covered by some health plans.
Right.
That if an emergency were to happen, sometimes the emergency personnel will see if you have emergency contact and medication attached to the app.
Right.
So that's always a great thing if we're into technology. But if you don't have a smart device like that, the simple just writing it out and at least putting the date on there, the last time it was updated, and make sure your allergies are listed as well.
Right, and I am very much allergic to aspirin.
Oh.
Okay, and if I take aspirin, my throat starts closing up.
It's an essential one to make sure.
And so I make sure that information is available, because I go around and I tell people, if something happens to me, do not let them give me aspirin, because it's all over with.
Exactly.
Yeah.
And so that's essential, because if someone were to have an emergency situation like that, good portion of the time that's one of the first things that they could be prescribing for pain, or if there's a heart attack. It sometimes is a process that they do, so that's good to have that notified. So good for you for doing that and being an advocate and sharing your example for others.
Yeah, no, I like to talk about it, because I always get asked, well, what kind of reaction do you have? Is it a rash? No.
That's a pretty significant reaction.
And it's a very significant reaction, because it's the beginning of my organs shutting down.
It's life or death right there.
And that's why if you do have anything that's medical, and not even an allergy that you need to know about, if you've got asthma, if you have diabetes, if you have high cholesterol, all the thousands of different things that go wrong with the body, it's good to identify, because you're unique, I'm unique, Heather's unique, and what's good for me may not be good for anybody.
Okay.
And so when those people from the paramedics come in to help you out, they don't know.
And it's a big, unfortunately, probably a stigma that we all have, is to carry that and feel that I don't want people to know what I'm taking. Well, it's really essential, because it could be life or death, especially in your situation
Right.
of an allergy. It's most common when we're children. as moms, we're making sure that our kids are not having peanuts if they're allergic, because they can be going to anaphylactic shock. But even if we age, we need to be responsible for ourselves. So that's one thing that we're able to do for ourselves by just having it either digitally or written down of what your allergy.
And it should be done either digitally or also when you go to the doctor, and will it be like Welcome Health or to some other medical group, make sure you tell them what your allergies are. Because now when you go to the doctor, and I don't know if Welcome Health does this, when you go to the doctor, most doctors, I'm not going to say all, but most doctors will send you home with a printout of what happened during their.
We do a summary of the visit with the doctor, because sometimes we kind of forget what was transpired during that appointment, and we can also share it to family and friends with the patient's consent to ensure that they're up to date of what was going on in that visit.
Now I know some of the Medicare Advantage plans, will have a program in for the smartphone where you can record the doctor's visit.
Correct. Sometimes, short-term memory gets a little bit more challenging as we age, and that's nothing to be scared of. So if it's best for you to record for yourself for your own records, you're more than welcome to do so. Just let your doctor know that you are recording, because they just need to know for the privacy of what can be mentioned during that and cannot, for your privacy in case it were to be lost for any reason.
Now the other thing, in going back to modern technology, both the insurance companies, medical insurance companies, and the medical groups now have where you can go into their icon and you can click on, like I have my chart. So does Welcome Health have something like the My Chart?
We have a digital platform if we have patients that have access to a smartphone, but we know some of our patients are not as tech savvy as some, but we're able to mail records or email appropriately if you just have a main computer and you don't have an app. So we're accessible to how you want your medical records to be managed.
And one of the things that I do know, some of the health insurance carrier for the 65 and above population will have some help in how to use those. So if you know what your benefits are, you may want to go in and look. Some of them provide to the seniors that benefit of helping them with the smartphone and your computers and the watches and all the technology that's out there today.
So the best part about Welcome Health is we do have a community liaison that's helping our seniors sit down and remind them of their benefits, because there's a change every year with your benefits. Just your basic over-the-counter to know how much it was. But knowing that you have IT services, if it's eligible for you, we can do a friendly reminder for you. That's not a problem. Or when I'm out in the community and I hear someone that is under that plan that has that benefit and they're having a challenge, I give them the friendly reminder. So as much as we try, we want to make sure, even if they're not our patient, we're making sure they're a reminder of their benefits, and always to circle back to the broker that helped them sign on, just to have a review, because sometimes it's overwhelming to know.
It is. I know one of the things that I do when I go out into the community, I like to give how to use your smartphone classes, and it's just like people are so appreciative of that.
And there's a difference between Android and Apple. They're two different languages. I'm an Apple fan, so when you put me on a Microsoft basic desktop, I still try to do the commands, the shortcuts from my Apple on there, and it's funny to some people, but it's a different language.
It is a total.
So the same thing when it comes to your phone entirely. So advocate if you don't know how to use it. There's someone probably right next door that can, but also look at your benefits with your Advantage plan if there's IT support.
And you also can go back to the place that you bought your smartphone, may it be an Apple or an Android phone, and ask them to help you. And one of the things that both Heather and I really push is ask for help. May it be for your health or using modern technology to help your health, because that's what it's there for.
We really want you to feel as independent as possible. There's times where we kind of shy away to asking questions questions as we age, and if anything, speak up. There's always someone that can be a solution for you.
Right. And I'm going to just go back to something that's a little off the subject, but also your local colleges have classes for seniors that will help them learn technology.
That's very true.
Yeah.
Especially if you're wanting just a little bit of education, that they're still doing some free or at no cost programs for you. So you just need to contact your local community college and see what there's to offer for you.
Right. So that, I mean, it's important to get used to the technology. Your grandchildren, if you're 65 and above, your grandchildren, if you go to them, they're going to know how to help you out. I mean, or they can fix you up.
Or going to your local senior center. There are community senior centers all over, both Orange County and LA County, I know that are very active, and they have different programs. So just keep on touch with their calendar, or just ask directly what you're looking for, and they'll let you know when that event's coming up that'll be best for you.
Yeah, and I just did some research for another show that I did, and for what was available for seniors out there, and I found that all the universities, it doesn't matter which one, have some kind of a program. Some may be a limit to their alumni, but some are open to the whole community.
That's awesome.
So if you're looking at, we're right down the street right now from the University of Long Beach, and they're part of a program that's called OLLI, and that's in a lot of different colleges throughout the United States.
And I know that they're in a local senior apartment in Long Beach, bringing resources and actually asking seniors to participate in studies so that they can help advance whatever they're focusing on to advance in technology or medication. They need those studies, so they're actually asking for everyone's help. So sometimes keep an eye out if you could be a case.
Welcome back to WGSN-DB Going Solo Network. And I'm still here with Heather Reid. And we're going to continue talking about, why don't we talk about what we talked about during the break?
So
I think it's really important, and we're talking about going on vacation. And I think that's, as she brought up, benefits, okay? So when you travel, do your benefits go with you? Because if you have straight original Medicare, and you have nothing else, you have no coverage outside of the United States.
And it could be very expensive if you go on a cruise and you're in international waters.
Yeah.
So you really have to think about that when you're traveling. I think about it when I go, and I'm not even 65 yet. And commercial plans are different than when it comes to Medicare. So I really strongly encourage.
Well, I'm going to give a really good example.
Okay.
About 5 years ago, I was in France, and I was on a tour, and one of the gentlemen on our tour, we're walking up to one of the churches, and it had rained, and this is very serious, he fell and he cracked his head open. Now, I did not know this gentleman personally or have a conversation, but I do know he had to go in for surgery. All of this affected his wife and the other people that were traveling with them, okay? I do know that some Medicare Advantage plans do have coverage. It's going to depend upon where the area you live in. It's going to depend upon the carrier of how much is being covered, okay? So you need to check, and it's just really important. If you happen to have Medicaid, and it could be called something different. I know in California, where we're from, it's called Medi-Cal. If you travel outside of your state, you have no medical coverage.
Well, internationally, no medical coverage.
But even outside of your state, you have no coverage.
And it's really nice that if you just call member services in the back of your Medicare Advantage plan, you can ask, is there a passport or something you can send to me that gives me advice when I am traveling what to do? Like if I need to go to an urgent care, or an emergency room. Most of the times you just keep your receipt if you paid anything to show proof to get reimbursed, but it's best just to get yourself informed before you leave. And my boyfriend's mom, she goes internationally by herself all the time. That's the first thing she does before she books a trip, is to make sure she's up to date on that. It's called a passport sometimes for some Medicare Advantages. So that's the first thing she puts in her suitcase so that she knows it's always there and up to date.
Definitely. It doesn't matter if you have a Medicare Advantage plan or even that supplemental plan. Those supplemental plans only provide you $50,000 lifetime on it. That's the wording on there. And so you may need to pick up other forms of insurance. Sometimes your travel carrier will provide you that, but you want to make sure what you're paying for. And travel insurance really isn't that expensive, because there's items that you should be looking at for when you travel. Yes, there's the medical part of it, but now you got to rebook those air flights. Not only have to book those air flights, where are you going to stay while you're traveling?
What if you fell ill before you leave and you just paid a full price for that flight? You can get a portion of it back.
Right.
So know that there's some things that life has set out for you that you don't know about, and it can be quite costly, but we want to travel. We want to be independent. Use that retirement that you've been focusing on, but do it safely. And there's a lot of ways to stay safe and financially keep that in mind as well.
Also, the other thing, and because we're talking about it, and then we'll go back to Welcome Health, okay, is that what if there's some civil unrest or you lose your luggage? That's also part of, you pick up extra coverage for traveling, which includes the medical portion of it. You want to make sure everything is taken care of for when you do travel with outside of the United States, outside of your county, if you have Medicaid, or in California, Medi-Cal. So it's real important you know what your coverage is, and this is one of my favorite subjects.
And honestly, I've had this happen to someone that I know personally. They had a medication reaction, that it's very common for high blood pressure, that you can all of a sudden have a swell up in your tongue or eyes, and it's an allergy that comes up long after you've been on the medication. So what if that happens? Just an example, I know someone that was on a cruise. Fortunately, the nurse on the cruise knew what to do, but what is that cost of that medication to counteract the swelling? It's gonna be quite expensive if you don't have the right insurance when you're traveling. So that's the best thing, is that just contacting your benefits and being aware, but talking to a broker and letting them know that you are a frequent traveler and that's important to you when you're looking at your benefits.
Yeah, and on the back of your card, like Heather was talking a few minutes ago, you're going to find the member services, customer service, client service. It can be named several different things. Call and tell them that you're traveling. And what is it that you need to do if you need to use any form of your benefits? And your medical group, you may want to tell your medical group also, like Welcome Health, that you're traveling.
If you have a chronic condition and it's your first time traveling in quite some time, let your doctor know. They can give you some advice on when you're in the air if something were to change, so that you're mentally prepared, and letting your family or any travel buddy that you're taking with you, if you have a chronic condition, that they're aware of, to help you in case there is an emergency.
Yeah, I think that's important.
Sometimes it's a common sense for a lot of people, but unfortunately sometimes we're so busy and so excited when we're traveling. Even if it's just a road trip, it's good just to be overly prepared sometimes, and a friendly reminder doesn't hurt.
Or it's something you don't think about. You don't think something's going to happen while you're on your travels. I was just speaking to some friends of mine last night. I think they said they were in Spain, and they had called to talk to me about something, and they were saying 4 people on their trip caught COVID.
Yeah,
and that was just like,
another thing we're all going to have to be aware of is what the regulations are. Every country is different. Knowing what your vaccines, not even just COVID, but vaccines in general, what you need to have before you leave, so you're not stuck in one country over another. Yeah,
I know last year I traveled to Brazil, and I had to have specific shots and pills in order to fly, to go into Brazil, okay? and you don't think you're going to need that. So depending upon where you're going, it's always a good idea to check to find out with the country. If you're traveling with a tour group, they're going to do all of that for you. But if you're traveling on your own, you need to look it up. And I know a lot of people like to travel on their own.
And because being independent and traveling is one of the best parts of life, besides just seeing your grandkids or great grandkids grow, is not, doing something that's great for yourself, brings you joy. And for some people, that's traveling.
Yeah, because I know, like, we like to now take one grandchild at a time on a trip. So last year we went to Washington, D.C., and one of the things we did, and this is not really part of our subject, but one of the things that we had done is we made sure that we had medical authority to have our grandchild, if something happened, we had to do something medically, we had the proper documentation, medical documentation.
Especially if you're going in a different time zone.
Right, we were in a different, and we were just within the United States. And I know in July we're going to be taking the next grandchild.
That's awesome.
He wants to go to Vancouver and Victoria, and we're going to take him, and we're going to have that information before we go.
I'll be your grandchild too. I'll go with you anytime.
I love to. I mean, but that's, something that's real important, and I'm glad you brought that up because that's just a real important subject.
My dad has a CPAP machine, so we're constantly making sure the regulations going through TSA is appropriate. So just, be overly prepared so that it's a smooth ride the entire time that you're on your trip.
Right. So if you have to take that high blood pressure machine with you.
There's nothing wrong with making sure that your health is your number one priority. So if you are diabetic, making sure that you have all of your supplies that you need, because it can be different. Brand names and all of that when you change county lines to let alone state lines and internationally.
Yeah, it's real important. So if you had somebody call you and say, okay, I'm going to, let's say for our area, Las Vegas, and they needed some advice, are you going to be able to help them out?
You're always For Welcome Health, our patients are able to give us a call. Our doctors are always on call when we're closed, and that's even on weekend and holidays, to advise you if an urgent care or emergency room is appropriate. But there's a lot of Medicare Advantage plans, even if you have a commercial plan or supplemental, that you could have access to Doc Talk, which is a virtual service or phone, or a 24-hour nursing line. A lot of this is free or no charge to you. But if you're a Welcome Health patient, we like that if you are seeing an emergency case come up and you're trying to judge if an urgent care or emergency room is appropriate, we have our doctor on call to help give you advice. And they're able to see your medical records right away, especially if it's a counteraction of medication, for example. And they'll advise you appropriately. Maybe it's just scheduling a virtual appointment the next day that is just a rash and you just need to have that managed. But if it's heart attack, stroke, or something, an emergency case, always go to the first available emergency room or call 911.
Okay. And if you're traveling and you need to call telehealth or some kind of a program that each of the different carriers have, or the medical groups, remember to take those phone numbers with you, okay? Have them available and they'll tell you what you need to do.
It's best is to ask. I think that's the common theme that we're saying here,
right,
is to make sure that you know your benefits. And if you don't, ask. If you need help with technology, ask. If you're going on traveling and it's your first time in a long time and you've had a change in condition since your last big travel, ask. What do I need to prepare myself? And that could just be an ask to yourself out loud. This is my first time in a long time and I've been diagnosed with diabetes and I've never traveled. Am I able to manage my sugar levels? Am I mentally and physically prepared to do that? Let me sit down and look at all of the tools that I need to bring with me and make sure it's packed up, and that's the first thing I pack out of everything.
Yes, so if you need on a daily basis to take your high blood pressure, you're checking your oxygen, you're diabetic, I mean, there's so many different things that people need nowadays to keep themselves going. I mean, I have a relative that needs that massage. Those are portable massage machines. whatever it is that you need for your health, take that with you. But also when you're taking it with you, and I can't express this enough, and I know Heather can't express it enough, take your medical information with you. Have it with you, like you said, she said, on that little piece of paper earlier, or using your phone or your computer with that information so they get it right away. I know people used to wear those, or I still know people that wear those medical alert badges. Make sure you have them up to date.
Please, you just don't know when an emergency is going to arise, and it's best to be overly prepared. Even just make a note on your calendar every quarter that you make sure that your medications are up to date. And that's even and I'm doing this as an example for myself. I put a reminder for myself on my calendar to make sure I even give my dog her NexGard every month because life gets busy.
Yeah.
And that's the same thing when I'm traveling and I'm changing time zones. The time of my medication's essential. There's apps to help remind you as well. So just know that there's a lot of technology out there to remind you, but it's just being knowledgeable and being willing to find out what that could be for you.
Yeah. So it doesn't matter, even if you're traveling from one state to the next state, or from one county to the next county, and you're going out of network, okay? If you happen to have an HMO and you're definitely out of that network, make sure you have what you need for an emergency situation. And don't forget about that phone number on the back of your medical card. Those medical cards are such a good resource. People don't realize the amount of information that's on your medical card. Your doctor's information, if you have an HMO, is on the medical card. What you pay for the emergency room is on the medical card. What you pay for your doctor's office visits, what your prescriptions are going to be is on that front of that medical card. And then on the back, there's also more information that you really need to look at. And when I go and I visit a client, I want to see their medical card so I know exactly what it is that they have.
And making sure you're carrying the most accurate card is, I want to just give a friendly reminder. I find so many seniors that still have their old Medicare card that has their social on there. Just another friendly reminder. Know that's no longer an eligible Medicare ID. Calling Medicare and getting the updated one because you don't want your social being exposed to anyone. But that's a common theme that I have seen, and it's nothing to be embarrassed of.
No, and one thing which you're talking about for the benefits change, as you said earlier, from one year to the other. The plans can change from one year to the next year. Even if you don't change, or you haven't changed anything, we had last year where a lot of plans were no longer in existence, that they had Medi-Cal, everything changed, and the card is different. So if you're still using that old card from 2022, it's not good anymore.
So just give yourself a mental note. As soon as you get your new insurance card, to shred the other one and replace the new one. And it's best just to go ahead and make a photocopy, especially that we discussed traveling, making sure that you have one family member or friend that is still staying at home that has that information for you in case you, for any reason, misplace any of that on your return back, or you're in the emergency room and they can't find that when you're gone. Your emergency contact person has that information for them.
That's one thing I have not thought about, okay?
It's like your passport and your driver's license. You always have an extra copy in your suitcase, and you always leave one behind for someone in case that something were to happen.
And I know I always have 3 copies of my passport when I travel.
I do multiple copies. I just like copying.
Well, I do. I have one in my suitcase, and I put one in my purse, just in case things get separated. And that's the same thing with the medical information.
It's essential because sometimes we just misplace that original card, and there's a lot of times where it's just nice that it's all in one 8.5 by 11 with all your insurance information, and it's easy for your family to find as well.
Right. I think this is great information.
We talked about a lot, so
we've talked about a lot.
May have to watch this a few times to observe everything, but there will be more.
I'm going to have Heather back on, and we're going to talk about many other things. We're going to, just to review real quickly what we talked about today. We talked about Welcome Health, that is a year old. I'm so excited for them, and I'm having fun watching them grow.
And just a friendly reminder, we are only accepting insurance. We do not accept private pays, so we want to bring access to seniors where they felt like they didn't have that before. So just give us a call if you'd like or are interested. We are accepting a wide variety of health plans in Orange County and LA County, which is in California. And it's a primary care physician group fully focused on geriatric care, so 65 and
benefits for you too, and a senior citizens forum. We're going to be starting podcasts. So one of the things I would love to have people do is call and talk to me, or email me, or go on to Facebook, and you can do that privately on Facebook. Tell me your experiences. Let me see if we can do a 5 to 10 minute podcast talking about, what your medical experiences are.
or what challenges you're facing and need help, and we can probably get you in the right direction.
Well, that I can get you in the right direction, and to do some podcasts. And if you need any help or you want any information about Welcome Health or any of the subjects that we talked about, both Heather and I are available to help you, and we would love to have comments. And thank you for watching. This is WGSN-DB Going Solo Network. Thank you.